right, let's finish up with genital herpes. So we just talked about syphilis, now let's talk about herpes. So, what are some of the signs and symptoms of a genital herpes infection? Well, initially, there probably aren't going to be that many symptoms. So there's going to be a long latency period. However, as this infection progresses, you could have vesicles appear. These vesicles you can think of as a large fluid-filled sac that's very sensitive. And it will appear on the genitalia, so think of the penis, labia minora, on the perineal region, or on the inner thigh, and buttocks. So the sensitive parts of your body. And these vesicles are filled with a clear fluid. They just look like a large colorless pimple, so to speak, or colorless whitehead that you can pop if you poked it. And they are intensely painful, whether they have burst or if they haven't burst. As these vesicles appear, there's just general malaise in the individual. The individual also will oftentimes experience anorexia, fever, or bilateral swelling in the groin. That bilateral swelling will typically happen, or the swelling on both sides of the groins, will happen as the fluid-filled vesicles influence osmotic pressures in the area and cause there to be edema of the surrounding tissue. Initially, we find that the initial infection can be completely asymptomatic, so we won't notice any negative side effects, or it can be painful enough to cause the person to go into the hospital. So there's a wide range of how it manifests in an individual. After that initial infection from herpes, there's going to be recurrent episodes throughout the patient's lifetime. These recurrent episodes, generally speaking, aren't going to be as severe as the initial episode, because at this point in time, our acquired immune system has been primed, and they can now partially fight off the pathogen. But it's still possible for there to be very painful lesions that form. These individuals are going to have outbreaks of lesions about 4 or 5 times annually. Once infected, generally speaking, most people are going to be infected for the rest of their lifetime. These individuals will have recurrent lesions appear indefinitely for the rest of their lives once infected. Approximately 1 to 2 million people every year are going to develop chronic herpes infections that progress to encephalitis, or swelling of the brain. And as this viral-based infection spreads to the central nervous system and causes encephalitis, we're going to have the brain and spinal cord start to not function properly. We'll start to lose homeostasis in those two organs. With the nervous system, or with the brain and spinal cord, as it swells up, there's going to be stiffness of the head and neck, and that can progress as the brain is swelling. That will cause mental disturbances, potentially comas, and the fatality rate of herpes-based encephalitis is 70%. So there's a high fatality rate if this symptom develops and it's not treated. How would you treat it? Would you use an antibiotic? No, you wouldn't, because it's a bacteria, or excuse me, it's not a bacterium. You would use aciclovir, an antiviral medication, to help reduce the amount of active virion particles circulating throughout the body. In the newborn child or the developing child, herpes simplex virus can infect them, and they can be destructive and fatal just like they can be in a fully grown adult. Most of the time, if a neonate or a fetal child has herpes infections, they have it because they got it through vertical transmission from mother to child. Occasionally, there's hand transmission, where somebody touches an active lesion and then touches a child and transmits it to the child. For infants, that disease is typically going to be confined to the mouth, skin, and eyes, and the mortality rate is about 30%. This disease, generally speaking, doesn't manifest itself in the general urinary tract of infants because that infant wasn't necessarily sexually active. That's not the mode of entry into the child. If that disease makes it into the central nervous system of the neonate or the newborn, there's a very high mortality rate associated with that. If a patient is pregnant and they have a prior history of herpes, they need to be monitored vigorously for viral shedding. And when we say viral shedding, we're talking about the active production of virion particles in her body. So instead of having the virus hiding inside of her cells in the latent stage, she's actively producing these virions. If there's no evidence of shedding or reoccurrence, vaginal birth can be indicated. However, if that woman has active lesions on her labia or in her perineum, down in her genitourinary region, vaginal birth is ill-advised, and cesarean birth is encouraged to minimize the chance of exposure of the newborn child to the virus. Herpes, or genital herpes, is caused by HSV-1 and HSV-2 humans, and these are going to be capable of initiating infection if they come in contact with genital epithelium. These are the two most common strains of the virus that cause herpes infections. There are other strains as well, but these are the two biggies. When we look at HSV-1, herpes simplex virus 1 can infect both the oral mucosa and give you those cold sores. And if somebody has a cold sore, generally speaking, it's a bad idea to have oral sex with them because that HSV-1 virus can be transmitted from the oral membranes to the urinary tract or genital membranes. HSV-2 is generally thought of as the genital virus, but if someone is actively exposing their mucous membranes, either their oral or their genital mucous membranes, to either of these viruses, you can still initiate infection. These viruses have a high tendency to become latent. And when I say latent, what does that mean? It's kind of a sleep, yep, that's a good analogy to use, or a synonym. They're going to be in the body but not causing symptoms to the person. Why the herpes simplex virus becomes latent is not clear at this time, but we've found that this may be linked to the HSV genome not being transcribed. So when we say transcription or transcribing, what does that refer to? Yes, genetics, but a specific kind of genetics. Production of RNA. So if we're not transcribing the HSV genome, we're not making messenger RNA, and if we're not making the messenger RNA, we aren't going to be making any viral proteins. So because this virus can hide in the nucleus of our host human cells for years, we can have recurrent episodes years after being clear from the virus or clear from the lesions. We found, though, that when looking at microRNAs, which are small segments of ribonucleic acids that help to fight off viral infections, that they may be linked to why that virus becomes latent for such long periods of time. And then we found that maybe potentially to treat this virus, we can upregulate microRNA therapies, or upregulate the amount of microRNA being produced in the body. This is an emerging potential therapy that's not very well established at this point in time. We've found, though, that even in peripheral cells in our body, that if it's latent in a central cell in our body, within peripheral cells there can still be a slow but consistent multiplication of the virus. So this also makes this infection particularly bad in that it can be latent in some parts of our body and actively producing virion particles in other parts of our body. So what kinds of things are going to influence HSV? Generally speaking, it can leave latency if you expose the body to some kind of a stressful situation. And that's true of all viruses that are in latency. So high amounts of stress can cause a reemergence of these highly painful vesicles and lesions. You can have UV radiation, aka lots of sun exposure, or you can have some kind of injury or any kind of other infection that can stress the body, or menstruation, as there's stress put on the woman's body during that process. Anything that can pose some kind of undue psychological or physiological stress can cause the virus to leave latent stage. Once that virus leaves latency, it's going to rapidly reproduce and make many virion particles that enter circulation. HSV occurs globally and affects many age groups. This virus is relatively sensitive to the environment in that it needs to have a very specific method of transmission. We need contact transmission. This virus is not capable of being transmitted as an airborne aerosol. Individuals with active lesions should be avoided as they are the most common method of transmission. But even if there are no active lesions, you can still transmit this HSV, herpes simplex virus, with direct contact to an infected patient. In terms of how common herpes is, it's more common than chlamydia and gonorrhea, but it's not necessarily a reportable disease. One of the reasons for that is because it is so common and because it's endemic to many parts of the world. If we look in the United States, approximately 20% of American adults have herpes. And once you get herpes, you will have herpes the rest of your life. There is no cure for herpes. The number of infected people in the United States is approximately 402 million, I should say. Again, about 20% of the U.S. population. And we find that 2/3 of the people that are infected don't even know they're infected, which causes this transmission of this virus to be rapidly spreading in the United States and other developed countries with promiscuous behaviors. So how can you diagnose a herpes infection? If you have large vesicles that are very painful in the genitourinary region, you can assume that it's from HSV and that the patient has herpes. Sometimes, though, if you want to get a more precise diagnostic, or if there are no lesions present, and you're talking to a patient who said, oh yeah, a month or two ago I had these really painful lesions, but they're no longer present, you can order some genetic testing on the patient. The polymerase chain reaction is going to look for viral genomes present either in the patient's tissues or from the lesions directly. Another way you can test for the viron is not necessarily to look for the viron directly, but see if the patient's producing antibodies for the viron. And if you test their blood and isolate antibodies for HSV from their bloodstream, that will tell you that, hey, they've been exposed to this virus, therefore they probably have this infection. This infection can manifest in mucosal cells and cause some very characteristic changes to a pap smear. And to review briefly, a pap smear occurs when you collect mucus and epithelial cells from the opening to the uterus or the cervix, and that's going to cause deformations to those cells. And if you do the pap smear and you find the characteristic deformations during the pap smear, that's an indication that, hey, this person has HSV. A common symptom of HSV, if you look at the pap smear, is that you see syncytia. Cells, infected cells that fuse together. So you have a large abnormal cell with multiple nuclei in it. Pretty sure that's on the next slide. Oh, or not. So yeah, syncytia, a multiple nuclei cell that's formed from a viral infection. So on the microscope, what do you look for after a pap smear? You look for these large abnormal cells. So currently don't have any vaccine right now for HSV. There are some in the works. Hopefully they'll be available soon. This text was published spring, January of 2016, and included data from as recently as fall of 2015 in it. So at this point in time, I would want to double check, now this spring of 2017, just to see how those clinical trials have come along. We might need to update that slide. Now, when somebody comes in contact with infected bodily surfaces, they are going to be exposed to the virus. The best way, the only way to guarantee that you won't transmit the infection is to never come in contact with infected tissues or fluids. So, if you're having intercourse, use a barrier method. Don't actually exchange fluids with the individual. If you're looking at a mother that has cold sores, those cold sores can be actively shedding virion particles. Individuals that have cold sores should be very careful while handling newborn infants. Those cold sores can transmit this infection from individual to individual. How do you treat the disease? Well, generally speaking, you're going to treat symptoms and not the actual cause of the infection itself. So we're going to give them some agents that reduce the amount of virions actively transmitting throughout their body, but we don't necessarily have a method yet to remove the latent infection, the viral genome that's embedded itself in the nuclear genome. So when we talk about treatment, we're going to talk about antiviral medications that target virion particles, but not the virion genome. Occasionally, we'll give the patient medications based on the frequency of their reoccurrences. So if somebody is just starting to develop these active lesions and vesicles, you can give them medication to reduce the length of time that they'll have those painful lesions and vesicles. So, what causes herpes? The herpes simplex virus 1 and 2 are the most common strains of the virus that cause that. If we look at this penis on the screen, we have a glans penis right here, a shaft of the penis, and what looks like a bunch of whiteheads, or large whiteheads on the penis. So if you see somebody with a lesion on their genitals that's white in coloration, that's going to be a big red flag that it's herpes. If that lesion is dark pink or dark red in coloration, it's probably going to be syphilis. So there's a much higher chance of it being syphilis compared to herpes. Another thing you can ask is, does it hurt a lot or does it not hurt? Or just walk away, even better. just say no. But from a patient perspective, not from a personal intimacy perspective, but from a patient perspective, if the patient says that it hurts and it stings like fire, or they use adjectives to say that it's very sensitive, think herpes. If they use adjectives that say it's not very sensitive, think syphilis. And that's all we have on diseases of the genitourinary system, at least that we're going to cover in the 3-credit version of this class.